opposite side, and that is what we term as the Rosen sign. The another clinical sign is also known as positive Schwartz sign for appendicitis. Positive Schwartz sign. With a positive Schwartz sign, the patient may keep the right leg flexed for comfort and experience increased pain if the leg is straightened. So if you want to find out whether the patient is having the Schwartz sign, the examiner will ask the patient to flex the right leg, right? And then the examiner will ask the patient to extend. In trying to extend, it produces pain at that side, so the patient will not want to extend the leg, and this sign is what we term as the positive Schwartz sign. Most of the time, there are several investigations that can be done. But if somebody comes to the hospital with nausea and vomiting, abdominal distension, fever, most of the time you will not know whether it's appendicitis or it's peritonitis or it's intestinal obstruction. So the doctor will request that the patient undergoes some diagnostic investigations which can help us to identify the exact cause of the condition. Right? We may suspect if the patient complains of pain in the right lower quadrant, but if the person is a female, the ovaries is also there. The colon also passes there, so you will not be sure. So some tests that are done will be abdominal ultrasound. Abdominal ultrasound. So with the abdominal ultrasound, it helps to assess the appendix to see whether it's inflamed or it's blocked. And then we can also do CT scan, MRI, computed tomography scan, and then magnetic resonance imaging. Laparoscopy can also be done. And then because of the infection, WBC count can also be checked. And normally, people with appendicitis, the WBC count increases above 10. Right? So below 10, it means that it's normal. But most of the time, it's above 10. So these are done to detect any abnormality of the appendix, right? And to help to diagnose the appendicitis. Most of the time with appendicitis, the doctor can start with medical treatment. So sometimes they start by giving some antibiotics to prevent the infection from occurring, and then some corticosteroids, which are anti-inflammatory agents to stop the inflammation. But if this fails and patient is still complaining of severe pains, the patient might have to go through a surgical intervention. The surgery that is performed for people with appendicitis is termed as appendectomy. Appendectomy or appendicectomy. Appendicectomy. So appendectomy or appendicectomy is the surgery that is done for people with appendicitis. Most of the time, as nurses, when a patient reports to the hospital with vomiting, with pains in the abdomen, with loss of appetite, we have to manage the patient even before the patient is sent to the theater. So, because this patient is having fever, so it means that we have to check the vital signs by checking the temperature, the pulse, the respiration, because already patients with appendicitis, all the vital signs are affected. The temperature is affected because of the infection. The pulse is affected because this patient is vomiting and can lead to hypovolemic shock. The BP is affected. The patient can have low BP because the patient is losing fluid, vomiting and losing fluid. The patient can have difficulty in breathing because the abdomen is distended and is putting pressure on the diaphragm, right? And then with this condition, you are not sure what is happening, so it's best you manage the patient on nil per os, so you don't give anything by mouth, and encourage the patient and relative not to take anything by mouth because the patient may be sent to the theater within a short period of time to help treat this condition, and patient cannot be sent to the theater when the patient has eaten. And then sometimes prescribed antibiotics are safe because of the high temperature, and prescribed antibiotics are also safe to serve as prophylaxis to prevent infection. And then it's very important the patient is reassured that it's not like HIV and other conditions like cancer where you don't have cure. So this condition has a cure. So you have to assure the patient of that. And assess the level of the pain, right? So you can use the pain assessment tool, either a scale of 0 to 10, where 0 is the least pain and 10 is the highest pain that the patient is experiencing. And then you can also use other pain assessment tools like the PQRST to assess, to know the intensity, know the location of the pain, whether the pain is being radiated to other parts of the body. And then you have to also, most of the time, because the patient is experiencing pain, you want to group activities together so that you don't disturb the patient. And then to prevent infection, you have to ensure that all invasive procedures on the patient to ensure aseptic techniques to prevent infection. If patient vomits, the amount, the color, the consistency of the vomitors, you have to serve your vomitors bowl and also assess the vomitors, right? And then you have to manage this patient on intake and output chart, right? It's very important so that you will know whether patient is becoming dehydrated. And then you have to also give prescribed IV fluid, especially patient is not taking anything by mouth. It's very important that the patient is being treated medically, or if it fails, patient is treated surgically, because appendicitis can lead to complications such as perforation, ruptured appendix, peritonitis, and then abscess formation. So we don't want these things to happen, which can even cause the death of the patient. So we have to encourage the patient to undergo either the medical or the surgical treatment that are available. And if patient is undergoing a surgical treatment, I've already talked about the general pre-op preparation for patients who are undergoing any abdominal surgery. So we have to know that the appendix is also located in the abdomen. So the psychological preparation and then the physical preparation as well as the physiological preparation is not different from someone who is undergoing appendectomy. So it's similar to the ones that we've done, like peptic ulcer and the other ones that we've done. Post-op is also similar, right? So you have to receive the patient from the theater, and then by checking the level of consciousness, so we go through the same process as we've already talked about in the other lectures. So it's not different. But a patient with appendectomy, the additional post-op care is that a patient with appendectomy might come with a drainage tube. So I talked about the Penrose drain. Last week we talked about the Penrose drain. So a patient with appendectomy might come with a Penrose drain inserted, right? And I said that the Penrose drain is different from other drains in that it doesn't have any bar connected. So it's just a small tube that is inserted in the skin. So, and then the drainage falls on the dressing. So I said that as a nurse, you keep changing the dressing. And then you make sure the tube is well secured. Make sure the patient is not lying on the tube. The patient does not touch or pull the tube. And then I mentioned that you check the incision site for any bleeding or drainage. And then you assess the site also for signs of infection, right? And then, so basically you have to monitor the patient on the drainage tube. But apart from that, all other post-op operation is similar to the other abdominal surgeries that we talked about. So this is where you end our lectures on appendicitis. right? Next week, God willing, we are going to talk about cholecystititis and then cholecystitis. So you can read on it before our next lectures. If you have any question, you can paste in the WhatsApp group and I will make sure it is addressed. If you have any contributions to, you can paste in it. By then, see you next week. God willing.